Go.
Hello, I'm Dr. Bamonte, and I'm out here today to chat with you a little bit about a sad topic, but dogs and cancer.
Dr. Bermonti, what are the most common types of cancer in dogs that you see?
So, we see a lot of skin cancer, so skin cancer or soft tissue cancer, which is kind of the lumps that you see underneath the skin. Um, we also deal with, liver and GI types of cancer as well. Those are probably the most common.
What causes cancer in dogs?
So, just like in people, we don't entirely know for sure. It seems to be, obviously, there's a lot of different types of cancer, but it seems to be a combination of genetics and probably some environmental causes as well. Occurs with this.
What are the signs of cancer in dogs?
So that can vary. There's a lot of different types of cancers, and cancer can affect almost any organ or body part that they have. With skin and soft tissue cancer, we will typically see tumors or lumps under the skin. So those are definitely something that we always want to address. A lot of them are benign, but anytime you see a new lump on your pet, definitely let us know. Other symptoms can range from weight loss, vomiting, and any array of symptoms based on where the cancer is.
What will a veterinarian do to diagnose my dog with cancer?
So a lot of the times, and we start with an exam, of course, that's how we find a lot of them. Sometimes we'll get clues based on changes in lab work, such as if you have liver cancer, we may not see any symptoms or outward changes yet, but we may have increased liver values on their lab work. And then obviously we can see tumors and issues like that on x-rays, ultrasound, those sorts of imaging tests.
If my dog has cancer, will they need to see a specialist?
Usually, a lot of the times, especially if it's more advanced, we may refer you to a cancer specialist, which is called an oncologist, and we do have several in Charlotte. A lot of the skin tumors, soft tissue tumors, we can deal with here, of course, and a lot of the times with those, surgery is curative. So again, it just depends on the type of cancer and how aggressive it is spread.
What does a cancer diagnosis mean for my dog?
Again, it depends on the type of cancer. Sometimes it can mean that we have to deal with what's in front of us, remove the tumor, we deal with that, and then they're cured. Versus if it's more aggressive or more advanced, it can mean sad news, of course. So it's hard to answer that because it varies so much depending on the type of cancer that they have.
What is the prognosis for dogs with different types of cancer?
So if it's a skin cancer or again a soft tissue cancer, it can be very good if it's caught early and removed completely. Other types of cancer, just like in people, unfortunately we don't find until it's advanced. One example of that is osteosarcoma or bone cancer, lymphoma, leukemias. They can do well with treatment for a little while, but usually the prognosis is worse with those types of cancer.
What should I do if I notice any new bumps or lumps on my dog?
So I would always schedule an appointment for that. What we'll typically do is, notate where they are, measure them, and usually start with cytology in hospital. That means that you'll see us take a needle, poke the mass a few times, and then we'll look at those cells under the microscope here. And we can typically tell if it's a cyst, if it's cancerous, if it's fatty, and then from there, decide what we need to do about it. Can we just watch it and see if it changes, or do we need to schedule surgery to remove it?
How is cancer in dogs treated?
So it depends on what type of cancer. I know I'm a broken record, but if it's we can surgically remove it a lot of the times. If it's more invasive or if it's a blood type cancer or a lymph node or lymphoma type cancer, we may need to refer you to an oncologist for chemotherapy, which is basically using, of course, drugs or medications to treat it. There's also some types of tumors that are not operable and that don't respond to chemotherapy. Those may need radiation, and we do have several radiation oncology clinics in Charlotte.
Is cancer treatment for dogs painful?
Obviously, if they have surgery, that's temporarily going to be uncomfortable, but we will cover them with pain medications. Some types of cancer, especially again, bone cancer or osteosarcoma, that is a painful cancer that we try our hardest to control that pain, but it is difficult, just like in people. And then if they have pancreatic, GI, liver type cancers, they can have some upset, visceral pain, GI pain, but we've come a long way with being able to predict that and treat that kind of pain in pets.
Can cancer treatments affect my dog's long-term health?
Not as much. So most of the time, once they've gone through treatment, they have very few side effects necessarily from it. Usually, once they're in remission or we've cured it, they feel fine. Again, there's always exceptions to that rule, but for the most part, there's not a lot of long-term issues to deal with.
How can I manage my dog's pain and discomfort during cancer treatment?
So that's something you work closely with either us or the oncologist, trying to make sure that they're comfortable. There's a lot of different type of pain medications, especially when you get into cancer type pain, to address where the pain's coming from and how often they need it.
What is the success rate of cancer treatment for dogs?
So some cancers we've come a long way. One of them that they can do fairly well with if they go to see an oncologist and go through chemotherapy is lymphoma. Again, skin tumors, soft tissue tumors, assuming that they're operable, we can cure most of the time with surgery. So again, it just depends on when this is caught, how aggressive we can treat it, and the type of cancer.
What side effects can be caused by cancer treatments for dogs?
So a lot of the times diarrhea or GI side effects is a problem. Again, there's a lot of different medications that they use to help with that. GI upset, appetite changes. They don't typically get the hair loss and changes that we see but definitely appetite and GI upset, vomiting, diarrhea are common with chemotherapy, not necessarily some of the other treatments that we do here.
If my dog has cancer, when should I put them down?
So, just like with any illness with pets, when we've reached, our limit or their limit on treatment, and we feel that their quality of life is no longer good, when they have bad days and good days, and we can't easily control their discomfort level or pain level, then I think it's fair to consider letting them go. Unfortunately, a lot of the times, finances may play a role because treatment for cancer can be very expensive. It's not wrong to not proceed with treatment if that's the case. And again, if their quality of life is not good and they're suffering, it is okay at that point to make that decision. But that's definitely something to call us. We even have a lot of appointments that we call quality of life appointments. That's what we're doing, is discussing with you, looking at the pet and trying to figure out what's the most fair time to make these decisions.
What does it mean for my dog to be in remission?
So some cancers, again, just like in people, especially different types of lymphoma, leukemia, you can treat it with chemotherapy, and it is basically gone for the short term. Doesn't mean it's not coming back, but the symptoms are not there, and the cancer itself is no longer detectable. So once you've treated a cancer and it is no longer detectable, you're considered to be in remission, or your pet's considered to be in remission. But those types of cancers also are prone to recurring when they come out of remission. But sometimes you don't know how long the remission period will be.
And final question, what should I do if my dog's cancer progresses or recurs?
So whenever you've gone through, or your pet has gone through treatment for cancer, you're going to be, of course, extra vigilant on watching them for any symptoms. So we probably will be rechecking exams and lab work and x-rays with these patients more often, so usually every 3 to 6 months. And then watching them for things such as weight loss, decreased appetite, vomiting, diarrhea, any new symptom. You probably, want to pay more attention to that than you might have before. I know these are sad things to think about, but it's, you know, always something in the back, I think, of all of our minds when we worry about our pets and their longevity. But any concerns, of course, let us know. Schedule an exam if you're worried. And any new lump or bump, bring to us and we will check it out and make sure